This video is to help you navigate through your CPT manual and help you discern what is a section, subsection, heading, and subheading. The most common error that I see in your assignments is not being able to tell which is which, so I'm just going to give a quick tutorial to show you how to tell what is a section, what is a subsection, what is a heading, and what is a subheading, and we'll also have an example problem that might help you when you're completing your assignments. So you can go ahead and pull out your CPT manual so that you can follow along. You'll see that it is a dark yellow and white coding manual. It probably has a spiral binding if you're using the professional edition. CPT stands for Current Procedural Terminology, and you'll be using this book when you're trying to code procedures in your assignments and on your tests for weeks 1 through 4 of our course. So go ahead and follow along with me and open up to the surgery section of your CPT manual. It should be located on page 65. This is going to be the table of contents of the surgery section. Just remember that these rules do apply to the other sections as well. So firstly, to start, we want to identify what is the section name. Sections are indicated in black bold font, so surgery is going to be the section that we're looking at. Subsection names are located in green font, so all subsection names within the surgery section will be indicated in green bold font. In this case, general and integumentary system are two of the subsection names within the surgery section. Headings are indicated in red font, so if you look on this page, you'll see skin, subcutaneous, and accessory structures, nails, pilonidal cysts, among other things, are headings that are indicated in red bold font. Subheadings are indicated in blue font. You'll see that we have quite a bit of subheadings in the surgery section on this page. So again, this is our surgery section table of contents. So now you're familiar with how the names of the section, subsection, heading, and subheadings look in the table of contents. You can go ahead and flip the page to the surgery section codes. That will start on page 67. And you'll notice that the color coding that we just learned about still applies in the actual list of codes. Again, remember that the rules apply to other sections as well. So you'll see the name of our section is still in black bold font, and that is surgery. Okay, and then the name of your subsections are still in green bold font. So general is a subsection name, and integumentary system is a subsection name. Your headings are still in red bold font. So skin, subcutaneous, and accessory structures is a heading. And again, subheadings are still in blue font. Introduction and removal, we see incision and drainage, and we see debridement on this page. So just make sure that you're paying attention to the colors, and know that if a question is asking you for a heading and you're writing down something that is in blue, then you're probably not writing down the right answer. Or if it's asking you for a subsection and you're writing down something in black, then you're not putting down what we're actually looking for. So now that you're familiar with how to determine what is a section, subsection, heading, and subheading, let's try a practice problem. Let's say, for example, we're trying to find out which subsection does the skin, subcutaneous, and accessory structures heading fall under. So first we would start with finding the heading that we're looking for. Notice on our page the skin, subcutaneous, and accessory structures heading. We know that it's a heading because it's in red font. Now our question asks, which subsection does it fall under? So in order to find that, we would need to find the nearest subsection that occurred before the heading that we're looking for. So we know that subsections are green. So which is the nearest subsection to the heading that we're looking for, that occurs before the heading that we're looking for? In our case, we see that it is the integumentary system. We have found our answer because this is the subsection that the skin, subcutaneous, and accessory structures heading falls under. I hope that this video has provided a little bit of clarification if you were having trouble determining what was a section, subsection, heading, or subheading in your assignment questions. Remember to use the assignment help that I've provided here in the student materials in class. I also email these to you every Tuesday. You'll see an example of it on this screen. It's titled The Coding Breakdowns. So you would just click on student materials, you would click on the week that you're looking for, and then find the document that says coding breakdown for the week that you're looking for. And this should help you with step-by-step guidance on how to find the codes and also how to find the answers to the non-coding questions in your assignments. If you need help beyond what I have provided here in the video or in the student materials assignment help in class, please know that I am here for you, so you can always reach out to me. You can email me within the course, you can raise a starfish flag for help, or you can call or text me at 210-538-4089.